In this video, we will review a comprehensive digestive stool analysis. This test is often ordered by a physician when they want to evaluate underlying causes for diarrhea, constipation, abdominal pain, but also many other symptoms like chronic headaches, chronic fatigue, fibromyalgia, arthritis, underlying causes for autoimmune disease like Hashimoto's thyroiditis, scleroderma. So don't be surprised if your doctor orders this test, even if you don't have any digestive symptoms. This is a sample report. How you collect this test is that the doctor gives you a kit, you bring it home and you collect the sample at home. There'll be 3 bags. One will be labeled day 1, another day 2, and another day 3. And the instructions will be in there on how to collect the stool. If you sometimes skip a day between bowel movements, that's okay. You'll just do day 1 the first time you have a bowel movement. The next day you actually have a bowel movement will be day 2, and then the last day will be the 3rd day. So when the results come in, which take about 3 or 4 weeks, you'll have these, the first category will be for your digestion. And they're looking at chymotrypsin, which is associated with how adequate your pancreatic enzymes are. A lot of people are taking digestive enzymes and they're not sure if they need them or not. So you can have this test when you haven't been on digestive enzymes for 2 or 3 weeks to see if you need them, but your doctor may want you to do the test after you've been on digestive enzymes to see if they're adequate. So ask your doctor how they want you to do the test, and because it can be done either way. These short-chain fatty acids help the doctor know if you need more fiber or probiotic. So this person's a little bit low, and the doctor may want to add some of those things. When you think you may not be absorbing your meats or your vegetables, you can look here. Usually you should be in the green where you rarely see any of those fibers in the stool. If you have a lot of them, then we know that's a problem with digestion. In this absorption category, it's mainly looking at fatty acid absorption and cholesterol absorption. So if they're in the red, we know that you may be deficient in the enzymes that help digest fat. In the metabolic markers, we have more information about the short-chain fatty acids in a more detailed form, and the different distribution. And this helps, again, the doctor decide if you need digestive enzymes or probiotics or prebiotics or fiber in your diet. Below that is an assessment of the immune system. So if we have high levels of fecal lactoferrin, we would have a higher suspicion of things like inflammatory bowel disease or infectious colitis. Might do, then we'll have to be looking over here to see if that would help us identify more specifically what is going on. When we look under the under macroscopic evaluation, what color is the stool? Is there mucus present? And if we see microscopic blood. Usually when we see microscopic blood, we think about the possibility of colon polyps or colon cancer. However, it can be a very benign thing, such as hemorrhoids, that cause that to happen. And then in this category, microbiology, we're looking at the beneficial bacteria, which is the good bacteria, and whether you have enough of each category. So NG stands for no growth. NP stands for non-pathogen, so it's a bacteria, but we don't think it's causing an infection. PP is a possible pathogen, so it possibly could be an infection. We have to kind of look at the symptoms the patient's having and decide if a treatment is needed. And if it's in the red with a P, that's a pathogen that we would want to treat. And we can treat that with an antibiotic, or we can treat that with an herb that's a natural antimicrobial. So you'll see in this patient's result, the 2 of the good bacteria were at a very good level, and 1 of them was no growth, and we'd like to see that 3 or 4 plus. When we look at additional bacteria, these are the bad bacteria. They can just cause overgrowth symptoms, which could be inflammation anywhere in the body, or they could possibly even be causing some abdominal discomfort or diarrhea or constipation. So there's 2 here that see PP for possible pathogen. And if we go down for a second, on one of the later pages, they actually take the possible pathogen of Klebsiella and they've tested it against different treatments to see what's sensitive or a good treatment and what's resistant. So if you used ampicillin for this particular bacteria, it would not work because the bacteria is resistant to that. They also, outside of New York State, this laboratory is allowed to test the possible pathogens with natural agents like berberine, oregano. And you can see this means it works better and has a higher sensitivity. And these don't work quite as well, but they're still pretty good. All right, so for each possible pathogen, you will get those results as well. One other category that's included under microbiology is mycology, which is yeast. So if any yeast species grew out in the stool, they will tell you which species it is and how strong it was. So this was a non-pathogen at 1+. There is some yeast present in the stool. It's not Candida albicans. However, in some patients, if they have a lot of symptoms of yeast overgrowth, fatigue, headaches, sinus congestion, joint pain, the doctor may still decide to treat it even if it's not in the yellow category. These are additional tests that the doctor can add on, but sometimes the doctor decides that it's not worth the cost of doing these additional tests. Pancreatic elastase is another assessment of if you have adequate levels of pancreatic enzymes and how much digestive enzyme may be needed and how strong of a digestive enzyme you might need. Eosinophil protein is a protein that's usually released when you're being exposed to food allergens. So this would help the physician decide if they need to do additional testing for food allergies. Calprotectin is another marker that can be used for inflammation, such as inflammatory bowel diseases or possible infection. The best is to be less than 50. This patient's borderline at 110. Bile acid factors are looking at primary bile acids that should be converted to secondary bile acids. So we compare the primary with the secondary. And if there's a reduced conversion, then usually this ratio is high, and that increases your chances for breast or colon cancer. And usually some of the treatments for that might be bile acid support or fiber or prebiotics or probiotics. There's additional bacteria that we can look for that have different effects on the body, but all these can cause inflammation and chronic disease. I've had adrenal fatigue or HPA axis dysfunction that's hard to treat or impossible to treat until you actually do a stool test and you find what's wrong and treat this, and then the adrenal fatigue will actually improve after that. So you can add on specific bacteria that may not have shown up here, and then you would have a better idea of what exactly you need to treat to help the patient. Now this report and all of the reports come with a verbal explanation of how to interpret your results. I had shown earlier the sensitivities and resistance charts. This test can be ordered with parasitology, which means that they would test for parasites. This particular report does not include parasite results, but most doctors, when they order a complete digestive stool analysis, would be checking for parasites. And I would recommend that if you had this test done, that you have that as well. You do not have to have, abdominal pain, constipation, or diarrhea to have a parasite. Parasites can cause a lot of chronic symptoms, fatigue, headache, joint pain. So don't always assume that you have to have digestive symptoms. So this was an overview of a complete digestive stool analysis. I strongly recommend this in most of my patients, and this video hopefully helped you understand why the doctor might be ordering that for you.